Welcome to today's webinar. My name is Luke Rowan. I'm a sales consultant here on the west coast of the USA, and I'm going to be taking you through today's webinar. So thank you for joining. Today's topic is all about exploring some of the success stories that we've seen in 2019. Obviously, EdApp really services a really broad number of industry sectors, and we see a very diverse mix of training applications on the platform. But today we're going to drill down on a few sectors, those that you see on screen: healthcare, CPG, retail and finance, and hopefully share some success stories that can then help you guys understand what's possible also for your industry. So we're very excited to have also a guest speaker today. Carl Husa is joining us from Healthcare Improvement Sciences. Hi, Carl. How are you?
I'm doing well, Luke. Thank you.
So Carl is a consultant that we work with, along with his team at Healthcare Improvement Sciences. And really, we work closely with Carl and his team to deliver some really exceptional solutions to other kind of organizations within the healthcare industry. So Carl, if I can give you the mic for 30 seconds, perhaps you can tell us a little about what you guys do at HIS.
Thanks, Luke. Thanks for having me today. We're singularly focused on bringing innovative training solutions to a difficult space. That's healthcare. We focus on a number of different industry segments, and we're finding that that EdApp particularly satisfies all of our requirements. Luke?
Thanks for that, Carl. So we'll healthcare is our first example that we're going to jump into. So if you can hang on the line, Carl, we'll get started in a second. So for those of you that are new to the platform, we really love to entice our kind of webinar participants to, if you don't already have an account on the platform, go to the URL that's shown on screen, and you can actually create a free 30-day trial. And this will give you the ability to test out all of the features, both in the authoring functions and learning delivery that we're going to talk about today. And we'll also post this link in the chat comments as well, if anyone wants to view it there. So we also like to draw attention to the fact that we actually have 3 offices globally. And what this really means is that for all of our partners that have deployed EdApp, we do offer a great amount of support. Obviously, it's very important to have support in your time zone. And with these 3 offices in London, New York, and in Sydney, we're able to offer that service. Additionally, it's also worth noting that we do have a global network of clients as well. So every day we see around 40,000 lessons delivered on the platform, and we also have thousands of authors actually creating that content, which at the end of the day really leads to us kind of developing a better product as we move forward. Okay, so jumping into today's topic, as I said at the very beginning, we're going to talk about 4 specific areas, but we also wanted to make mention that for those partners that we do help deploy programs, we do see a really broad set of training. So that could be leadership training for large corporates, training for financial teams, various onboarding programs across different sectors. We also deliver quite a number of programs where EdApp is offered as a blended solution with various face-to-face seminars for both pre and post training. We also look at campaigns for compliance and health and safety. So although we're going to drill down on a few examples today, we really want to make sure that everyone knows that you can really deliver whatever type of solution you like on our platform. So the 4 areas that we're going to look at are Firstly, training for various roles in the healthcare sector, and Carl is going to help us out there. The second topic is looking at training for sales teams in the consumer packaged goods industry. Thirdly, we'll have a look at what training looks like for store associates in retail. And then finally, wrapping up with a nice little case study on cybersecurity training in the financial sector. And for those of you that would like to see other industries covered, feel free to shoot us an email or pop a comment in the chat. And we'll take note of that and ensure that the next webinar, perhaps we can speak to a different industry or a different type of training application. Great. So obviously we're going to talk about quite a number of different examples of microlearning in today's session. And for those of you that want to get hands-on and actually interact with some of the material that we'll show, we've actually created a little example demo account. So to participate, it's really quite simple. All you need to do is download the app, log in, and then you can compete with those others participants on the webinar. So the first step there, for those of you that don't already have the app, if you'd like to you can either activate the camera on your phone and scan that QR code on the left, or alternatively, you can also just launch the App Store on your device and perform a quick search. So I'll leave that up just for a second and allow those that want to participate to be able to jump on and download the app. Okay, great. So for those of you that actually have the app, you can then essentially when you open the app for the first time, you'll see an option to enter an invite code. So we have a specific account set up for this webinar. So when you get to this step, just key in the word on screen, webinar, and then that will take you to the following screen on the right-hand side where you can just enter in some credentials, including a 10-character password, and that will permit you access. As you do this, also consider that this is actually one of the methods that we use for onboarding new learners, and it's really quite popular because it, essentially, as you'll see, signing up and registering for EdApp is very, very quick. And then thirdly, we've actually set up some of the other kind of auxiliary features to microlearning in this demo account. So you'll see a leaderboard and you'll also see our real rewards feature in action. So when you log in, feel free to check out those features, and we've even uploaded a couple of digital gift cards just to incentivize you to participate. If anyone needs help signing up, again, feel free to hit the chat, but we'll move forward with the webinar. Okay, so jumping into our first topic, and Carl, if you could help and jump in here. So we're going to be looking at training for the healthcare sector, and specifically, what are the challenges that face various roles in the healthcare sector? And then looking at what are the specific benefits that microlearning and in turn EdApp can offer. So really for today, obviously there's a very many number of roles in healthcare that we could look at, but today we're going to focus on three main roles. The first of those being pharmaceuticals. So Carl, if you could help explain here.
Sure. Pharmaceuticals, we focus primarily on the U.S. healthcare market. It's highly regulated, lots of layers that include compliance requirements from national, state, and federal regulators. And pharmaceuticals is one of those industries that's heavily regulated, particularly when it comes from advertising perspective. So one of the things that they do is they provide what's called education around disease states. So for facilities, an assisted living facility, for example, they may provide training on recognizing seizures, or classification of seizures. And that training has to target not only physicians, but also care workers who are typically not trained very well. Drug interactions and actions and indications, what happens when you give a particular drug to a particular patient, what you need to watch for. Product education, if there's a specific product that a pharmaceutical company has that can address one of those disease states, there's always usage issues surrounding that. And then finally, disease state observation and reporting. What's happening to the patient? What's an unbiased of reporting the facts that are important for ongoing care? Healthcare providers, and here we're talking specifically about physicians, nurses, physicians assistants. One of the big problems is resiliency and burnout prevention. The current statistic is that one physician commits suicide in the US every day. Quality improvement, how can we take this rather large, slow-moving institution of a hospital, for example, and help them to improve their quality? Continuing medical education, which is a requirement in virtually every state for physicians licensing and also for nursing licenses. And then finally, regulatory and compliance updates. The environment of healthcare changes very, very quickly. And there are policy and procedure considerations to make sure that the organization is aligned with those changing regulatory and compliance requirements, not only from government, but also from insurance companies, from payers, and from national organizations that manage some of the aspects of US healthcare. One of the current developments that we're seeing that's particularly challenging is that much care, as the population ages and more move into either home care or to assisted living, we're discovering that more and more care has to be provided, and that care is being provided by folks who are not particularly well educated and unfortunately not particularly well trained. So you can see that there are certified nursing assistants, family caregivers, and those two are share some characteristics in that these are task-based practices where they have to help with somebody with nutrition or have perhaps oral care or perhaps hair care. The difference is a certified nursing assistant is typically going to be working in an assisted living facility where the family caregiver is going to be at home taking care of a family member. One of the fascinating things about certified nursing assistants is the considerable turnover that institutions face. In some institutions, it's a 70% turnover rate at a loss of somewhere between, at a cost rather of somewhere between $6,000 and $8,000 per certified nursing assistant that leaves. Okay, Luke.
Brilliant. Thanks for that explanation there, Carl. So now that we have those roles set out, if you could speak to the challenges that are faced by all healthcare professionals.
So healthcare is I've spent decades in healthcare, and one of the things that I've always seen that everybody's always told me is I don't have enough time to do my job. And with the implementation of electronic health records, providers particularly are complaining even more that they're spending so much time on documentation projects or documentation requirements that they don't have time to render care. So they have a limited time available to be trained on aspects of care that are required, continuing medical education and compliance, for example. The knowledge environment or ecosystem of healthcare is becoming increasingly complex. And because they don't have a lot of time and because the knowledge is getting much more complicated, it's essential that the key information gets in front of them at the right time. And then finally, there's this complex layered compliance and regulatory environment. We have to talk about this when we talk about healthcare in the United States. There can be as many as 6 to 12 different compliance requirements or different compliance organizations that intersect at the patient's bedside. It's a complicated environment. Now, if we look at the specific challenges that caregivers face, okay, and when we talk about caregivers, we're going to talk about both CNAs and also family caregivers. These are not uncommonly low skilled, low economic status, and they may not have access to computers for traditional online training. This is particularly a problem with family caregivers. There may be language barriers. In the South, for example, a major portion of CNAs are Hispanic, where in the northern part of the country with family caregivers, we're seeing, in one particular instance, we're seeing 5 or 6 different languages that are spoken in these families where these folks have to provide care. And finally, there's financial considerations for training non-exempt employees. You cannot require them to take training at home after hours. If you do that appropriately, you have to pay them because they're hourly. So training, pulling somebody off the floor for an hour or two to get training is problematic, because you have the opportunity cost of them not being able to take care of folks, and then you also have the direct cost of having to bring them in for training.
Brilliant. Thanks for that explanation, Carl. So now that we have those challenges set out, let's talk about the benefits of microlearning in general, and obviously Ed ties in very closely here. But you know, I think you've made a great kind of resounding point to me that microlearning is really quite a perfect fit for this industry.
One of the features of microlearning that we've discovered and we're starting to leverage now is that because the content model, you know, I like the word chunking. I've been using chunking for years. Because the content model is chunked down into these micro lessons. If you plan your content model correctly, you can take those chunks of information and you can reassemble them so you get reuse. So you create once and you reuse many times. There are a couple of ways of doing that, but what this enables you to do is have a common corpus of knowledge that's being presented to diverse audiences, and yet at the same time you can take that corpus of knowledge and you can specialize it for those individual audiences. The other big advantage, obviously, is training anytime, anywhere. I had a friend of mine who was taking a master's course in public health, and it had a micro-learning component to it. And one of the things that they were saying was that they could study their programming formulas at night while they were giving their kid a bath. And then finally, there's high engagement and motivation, both from extrinsic motivation of badging and leaderboards and the reward system, which is really cool because they're real world rewards. It's not some merely an abstract badge. And then the other is, because we interact with our cell phones so often, one study I read recently said 150 times a day, we're already engaged with the device. So if we provide highly interactive training that can be taken quickly and has good recall, then we get high engagement and motivation. And then finally, EdApp's analytics that they have on the back end are great for compliance reporting. Healthcare space, a really good example is HIPAA, where you have to, this is the privacy law that governs in the what's called personal health or private health information in the United States. And by having this analytics back end, either directly through the dashboard itself or through the API, you can extract information so that it makes your compliance reporting easier.
Brilliant. Thanks for that, Carl. I'll have to take that little term for chunking. That makes a lot of sense there. So let's look at the benefits for healthcare providers.
Um, the bottom line is better patient care, and there are a couple ways of achieving this better patient care. One might be direct transfer of knowledge that impacts patient care. So what's the current quality requirements for collecting data or for treating a patient with a new pharmaceutical product that's going to improve the patient's life. But there's an indirect benefit as well. In the United States, there was something called the triple aim that talked about how healthcare should be aligned. One of the things that it left out was it left out physician and provider resiliency. So that's been updated now to something called the quadruple aim. And it's been shown that if physicians are overworked or if they are overstressed, the quality of care declines, and in some cases precipitously. So one of the ways you can provide better patient care as well is by having microlearning that has resiliency training. And there are a couple different forms of that. Resiliency training to help providers become stronger. Nimble continuing medical education, we talked about this complex layering of regulations and compliance and standards. Things change quickly. When things change quickly, you want to be able to push out information quickly. And this gets back to that chunking piece again, because the content model chunks are small, and because Ed has push notifications, it's easy to get updates out. Near real-time feedback. If I'm managing a complex health system and I'm a control freak and I want to see what's happening with my learners, I can check that with Ed's analytics. The ability to create microlearning quickly. If you're really good at templates and you have a good system for transferring knowledge from your SNEs into a format that's usable, this is amongst the fastest. Ed's templating system is so cool. It just makes creating microlearning really fast. It's also engaging. And then finally,
if I can jump in here quickly, a question that we commonly get about our platform is, okay, a specific customer might understand that we say that we can build out content quickly, but for you and your team, how long did it take you guys to get up to speed with the authoring tool that we offer?
Yeah, I spent the last 10 years as a chief learning scientist for a conventional online consulting firm. We did higher ed and we did corporations, and it took me about a week to get comfortable with the idea that the templates do so much that we had to do manually before. And then Luke knows that my partner and I are pretty aggressive when it comes to manipulating the platform. And after only about 2 weeks, we discovered this wonderful thing called cascading style sheets and the support that Ed has. So we went from complete novices to feeling very comfortable about doing things in less than a month.
Brilliant, brilliant. So let's have a look at the benefits for caregivers. We just covered off healthcare professionals.
So we talked before about one of the challenges is that CNAs and caregivers typically, or it's not unusual that they don't have access to computers, but almost everybody's got a smartphone. And if they don't have a smartphone, there are institutional ways of getting them smartphones for free or cheaply. So they've always got them. We're habitually using our smartphones. Short training chunks can fit into the workday. Again, this is the challenge of a non-exempt employee who can't be required to train after hours. So we want to make sure that we have training that's effective, but also fits into their job duties so that performance isn't affected. Fits into their complex lives. My goodness, some of the stories I've heard about CNA candidates who are in a program. Many of these they're almost always female. They may have, they're a single mom, they have multiple children. In a lot of cases, they're also caregivers for senior family members who may be living with them. And their lives are so remarkably complex and stressed already that the one thing that we don't want to do is layer on, oh, you have 2 hours of homework to do tonight. And then finally, a lot of these assisted living facilities and a lot of the caregivers are in rural communities. And one of the challenges there is that Wi-Fi and internet access can be wonky. So Ed has this offline mode that enables folks who don't have a current connection to still work and then update later when they get a connection. So we find that microlearning specifically fits really well into this really challenging segment that needs to be educated.
Brilliant. Thank you for that explanation there, Carl. So what we'll do now is actually show you a micro lesson that we've built in the healthcare industry. And Carl, if you can take us through some of the templates that we've used, and that will help kind of give everyone context to all of the arguments that we've just put forth. So just bear with me 1 second. So I'll boot up the browser here. So what we're looking at right now on screen is the EdApp authoring tool. And we've skipped to a specific micro lesson that has been built. And this particular lesson is on the transitions of care. Carl, if you can help me through, I'll step through the templates here. And if you could just explain why we use the template and what value it adds. So firstly here, the template that we've used to introduce this lesson is called Scratch Off. So simply the interaction is that the learner is scratching away an image to reveal text behind. Is there anything worth noting here, Carl?
Yeah, one of the reasons we like to use this interaction early is an element of surprise about the interactivity of Ed, so that folks start to get accustomed to having their fingers on the screen doing things as an active learner instead of just reading.
Brilliant, brilliant. And the second template we have here is an assessment where we're assessing a specific variable in a sentence presented.
Yeah, we like this one again. It's interactive. The number here is particularly high, so you can see that it's 60%. Most folks don't get near this amount, so it's a good way for us to set the stage of how severe a problem medication errors are. The other thing we like too is the availability of feedback that we can use both when they get an answer correct, so we can give them a little more information if we want to, and when they get an answer incorrect, we can help them set the context of why that was incorrect.
Right. And here we have a template that allows us to step through various statements and present quite a lot of information.
Yeah, so one of the challenges in healthcare, in other industries as well, but we find it particularly in healthcare, is there's a lot of information that you need to display. And the one thing that you don't want to have is this long river of text that they have to scroll through, where you take a 14-page PDF and put it on microlearning, right? That's not microlearning. So there are two challenges associated with this. One is you have to get in the mindset of having your content in these small consumable chunks. And then you have to pick an interaction that says, okay, look, they're not all going to fit on the screen at the same time, but we want to make sure there's someone there for context all the time. So that's why we like to have this scroll interaction.
Brilliant, brilliant. Thank you for providing those insights, Carl. That's really helpful. I'm going to jump back into the presentation. In the essence of time, we should jump into these other categories, but I've definitely loved hearing you speak about the challenges and benefits of microlearning, and really many of the things that you've described challenges that we see in other industries as well. So I'm sure as we work through these other examples, a lot of what you said will also resonate for the other industries. Thanks again, Carl.
You're welcome.
Wonderful. So our second category is training sales teams in consumer packaged goods. And we work with, quite a number of clients in this particular area. So looking at some of the training use cases that we tend to find. So anything from product training to delivering sales skills and soft skills, marketing excellence programs and onboarding. Obviously, sales teams are also educated on many other things, but these are some of the more common use cases. Looking at the challenges facing training sales teams. So obviously, a sales team is often dispersed in various locations across a particular market or many markets. So obviously that ensues the fact that bringing teams together can be expensive. Also, face-to-face sessions don't really allow for ongoing analysis of knowledge and skill sets. Thirdly, obviously in this particular industry and for this particular team, there is a need to constantly release new training content around product releases and market changes. And the more traditional solutions or slower moving learning solutions don't really capitalize on this. And then finally we see a requirement to localize content by market. So obviously a nimble solution that will allow you to adapt content is highly relevant. So what does microlearning and EdApp do well? So we have two examples on screen here, two examples of knowledge transfer templates that we can use that are great for delivering key brand messages. And as you can see with that interactive example, we're using the template that we just walked through, scratch off, and there you're kind of revealing a statement that is a key message around the brand. And I will direct you guys, for those of you that have actually downloaded the app and logged in to that webinar account, you'll see both of these examples in the application. So the second benefit is around assessing product knowledge. We have, I would assume, over 50 interactive templates that allow you to pose anything from a multiple choice question, which you see on the right-hand side. And there is that example is actually using a video at the top of the screen and then asking a multiple choice question, to the example that you see on the left where you're dragging the image into its respective bucket. So these types of really immersive interactions allow our customers to be able to assess knowledge ongoing. Given that we're talking to sometimes remote teams, the content needs to be gamified and fun. So we need to keep that level of engagement high, which then in turn leads to very high completion rates of the content and high retention rates of the knowledge being delivered. So the example on the left there is our template for Find a Word, which is really quite fun. And then on the right there is a true-false game where you're swiping the image with your thumb. So EdApp is also great for improving sales competencies. So it's not just about product training or other elements of education. We see very much hand in hand some competency training delivered with ongoing product education. And again, speaking to the templates used, the image gallery template there where you're combining an image with text is really fantastic. On the right-hand side is an example of an ordering template where the user is dragging and dropping the steps. In this case, to the order in which a persuasive selling process might be handled. And then finally, the really key benefit for training sales teams is really plays into one of the challenges that I mentioned, which is your ability to build content really quickly and deploy it. And that really helps us to meet the demands of constant product releases, and also localization by market is very much helped here. Let's talk about training retail associates. Again, we have many global customers using the platform. So through dealing with these customers, we've really learned a lot about how EdApp can help. Starting off, here's a list of some of the more common training use cases that we see for retail. So anything from customer service acumen, also product training, ensuring promotions stay top of mind. So this was actually something that we didn't initially anticipate in retail, but through the use of our customers, we've come to find that EdApp is a great way to deliver information about promotions. Obviously, a micro lesson can be very short. So essentially, we see partners delivering videos about their upcoming promotional calendar, and then presenting perhaps a little game to test the knowledge and keep that top of mind. So what are the challenges in training retail associates? Obviously, retail associates tend to be younger employees, and as such, the challenges are high staff turnover, casual workforces, and really, given that this is the type of resource available, it's really difficult for our retail partners to be able to educate their staff and really make them advocates for the product that they're selling, and in turn giving a really incredible guest experience. So how does microlearning help? Obviously, we want to make accessing content as easy as possible, given that our audience is not super engaged from the get-go. And EdApp and its various features really give us the ability to deliver content anytime and anywhere. Secondly, product knowledge is kept top of mind. Bite-sized learning is proven for higher memory recall, and the delivery of frequent content every week helps to ensure that those key messages around the products that a retail associate is endorsing are kept top of mind, and they can do a great job in selling them. Okay, so that wraps up our 4 topics. Thank you again for joining today. Hopefully we've uncovered some challenges for those of you that have interest in the industries that we've presented. And we'd also just like to make mention that you know, if there's anything here or any particular industry that you would like us to explore in the future, feel free to shoot us an email or pop a note in the chat right now, and we'll record that down and make sure that we present something in the future.